It is so inspiring to see such a full, diverse, engaged room. And I just want to echo the thank yous that Jim and Jasneet shared to each of you for the time and curiosity and engagement you're bringing to this supremely important topic. I want to thank our leaders, Supervisor Pine and Supervisor Horsley, for helping us lead the charge in San Mateo County for what we can do to be climate ready. It's really inspiring to be a public servant under leadership that is so future thinking, engaged with each of you in collaboration. I also, in thinking about where we've been on this journey, I stood up with this is my first of the 6 to attend, and was kind of relieved that some of you are right there with me, and this is not some total insider club. We can all join, and we can all be a part of. I feel like this specific convening has a way to shift from the what and all we've learned about the specific disasters to the who. Ultimately, our planet that is such a sacred treasure is made up by the who, and who we are and what we bring and who are we prioritizing in preserving our future. As I was thinking about the activism of the young people, I'm a mom of a 15-year-old high school sophomore, still standing, who spoke their truth on Friday. I've learned a lot about this journey from my own son, a 15-year-old, who's come to a consciousness that our generation did not have, and I think we're catching up with our young people and thinking about the world we will leave them. My son happens to have a passion for a classical Indian dance that's rooted in hundreds of years of tradition, and there's this great practice in this dance form where every dance, whether it's a practice or rehearsal or a performance in front of thousands of people, the first thing they do is they ask permission from Mother Earth to stamp on her. Because we can't take that for granted. We can't take Mother Earth for granted. And so I'm asking permission from all of you to share some facts. We can't take that for granted always either. So my job in the 10-ish, 15 minutes I have is to give some facts about health inequities and the root causes in our community. So, and just a quick bit of background, I serve in the public health department for San Mateo County. We are your public health department. We inspect the restaurants, and we ensure that if you had to call 911, we hope you don't, an ambulance would come there quickly and would provide accessible, high-quality care. I'm really grateful to Brian O., who is a part of our health policy and planning team that has been a part of the series of convenings and has helped us prepare for what I'm offering today. Our mission is longer and better lives for everyone in San Mateo County. And what we know is that every one part of longer and better lives requires a specific focus on inequities. We don't come to health equally. We don't get to experience well-being equally. And we have to understand what keeps us from producing the same excellence in health for everyone who lives, works, studies in San Mateo County to get better for everybody. And so I think my role in tying that to our climate agenda is to really give some depth to what do we know about those inequities, how they're distributed, and what the causes of those are in our community. When we think about the destination we're aiming for, this longer and better lives for everyone, and what is health, if any of you have attended a conference with a public health person, it's just like, oh yeah, it's all health, like we're not always modest about it. Our definition of health borrows from the World Health Organization, and it's about this overall state of physical, economic, social, and spiritual well-being. And that's just to paint that when we think about health locally, we're not just thinking about can we perform basic activities that get us through the day. It's can we thrive, Can we be our best selves so that we have our best community and so that we can support our best future? And the climate challenges that are in front of us challenge every dimension of that definition. Of course, what you have been reflecting on, whether it's fire or flooding or other types of disaster threats, threaten our physical well-being. but they also threaten our economic well-being. You know, who's going to be able to work? How are we going to be able to produce and support this thriving Silicon Valley economy that we're a part of? Our social well-being, if we're not going to be able to get out of our houses, I mean, even the small inconveniences we experience relative to our neighbors to the north in Butte County, you know, of being with family, of being with loved ones, of being, you know, in the places where we can thrive, we're threatened by climate. And then our spiritual well-being, you know, it takes this mix of reality and hopefulness to get through the challenges in front of us. And certainly the climate challenges pose an existential threat, and we have to find the ways to keep replenishing the spiritual hopefulness that will enable us to overcome what's in front of us. So with those destinations in mind, longer and better lives for everyone, and a definition of health that is holistic and inclusive, and really thinking about the total picture of health, we turn to kind of what makes differences and how do we get to that everyone in an inclusive, holistic way, that inclusive bubble that was in Jasneet's opening. And I want to just share a public health framework. I think probably in environmental activism you have some very similar frameworks around equality, equity, and justice, and center a little bit in equity and what it means for us in public health, and why it is such an important underpinning for achieving the goal of a healthy, equitable community. The roots of public health, and really important to public health, certainly include equality. And that picture on the left-hand side is that we certainly have some supports that we need to have equal for everybody. It happens to be flu season right now. We are recommending the same flu shot for everybody. I hope you get your flu shot. And it's going to be the same dose, you know, the same mix of antibodies that are in that flu shot for everybody, and that works relatively well. But access to getting that flu shot is not distributed equitably, and we pay special attention to those populations that might have a harder time getting preventive health care. If you're working 4 jobs, if you're not near transportation, if you're balancing other burdens, then an equity orientation impels us that we make flu shots available in the communities that have the greatest challenge of getting to a doctor, of having doctors who speak your language, of having doctors who know your culture. And so, for example, when there was a hepatitis A outbreak in San Diego County, and we saw that there were trends that was especially challenging for our homeless residents, we had proactive vaccination through our mobile clinic, you know, in the communities in which our homeless residents were experiencing. Equality wasn't enough. We had to take an equity orientation to making sure that the antidote got to the folks in the dosage and in the way and in the manner that could get to everyone's need being met. The middle picture shows, you know, different shape of support, the boxes that allow the view of the soccer game. I also want to acknowledge that in public health, the justice view is also important. We are centered in an equity orientation, but we're often providing technical assistance or facts or advice to those of you who are warriors for social justice and are warriors for climate justice. The Affordable Care Act made sure that preventive measures like a vaccine were available at no cost. You know, if science has shown that this is a preventive measure that everyone gets, there's now a federal law that makes sure that there's not an economic barrier for you getting that flu shot. So each of these is important: equality, equity, and justice. We come to our work in public health with a very equity orientation because we have seen the deep roots of inequities in determining the health outcomes that people experience. But we're also really prepared and willing to be side to side, shoulder to shoulder with those working towards justice in all aspects of what we're aspiring for. As we think about the root causes and understand what the science has taught us of what contributes to health, our aspiration is longer and better lives. We look at key statistics like life expectancy. Some people are surprised to learn that only about 20% of health is about clinical care. If you've ever been sick, if you've ever had a family member who's been ill, Access to a clinical professional and the quality of the clinical care you receive is certainly important, but overall, when epidemiologists look at how much that contributes to your overall well-being, it's about 20%. That's that second to the top box. The other 80% is really about the conditions that are around us, the environment that is around us, this great alignment with the agenda that you all are working so closely on shaping around our physical environment. At the bottom of the table, air, water, those affect health. Housing and transit, those affect health. The social and economic factors also contribute significantly to our ultimate ability to thrive and live good lives. Education, employment, income. These together are what public health calls the social determinants of health. It's those conditions in which we live, work, and play. And they're absolutely crucial to determining how much health we experience. The 30% that are health behaviors actually also have a correlation to the environments and the conditions that we live in. So, tobacco use and what we're seeing right now in the news and the risks that are right here around vaping, access to how easy is it to get that counterfeit vaping product is influencing that behavior of whether our young people vape. So it's really important when we think about how to get to that destination of healthy to understand that about 80% of it is really contributed to by the environments and conditions in which we live, work, and play. This concept of social determinants of health is not just a public health understanding. Many of you joined with folks on our policy and planning team as we developed in 2014. What is our vision for a healthy San Mateo County community? What does healthy look like for me as a resident in San Mateo County or as an employee working to serve San Mateo County? And really what bubbled to the top, talking with hundreds of people like you, and I hope there were many of you and you're involved in helping us refresh this plan for the next 5-year time frame, were elements of these social determinants, the 4 priority issues that emerged to the top as what is most important to be healthy in this community: healthy housing, healthy neighborhoods, healthy schools, and healthy economy. I don't think that would shock any of you. I don't think that is counter to anything you would choose for your own families. If we don't have these things, we can't be healthy. And those environmental conditions are really important to getting to longer, better lives. So I get to share some data. If we think about those social conditions and what they're doing and what is it telling us about our trends, these are decades in which the health is largely being driven by chronic diseases. And unfortunately, this is the part where you have to balance the hope with the reality. Almost all of them is getting worse. In every measure of chronic disease, if you look at 10 years ago versus today, we see that trend going upward, not downward. Specifically in issues that are, really obvious and linked to our environment, issues like asthma, issues like chronic obstructive pulmonary disease, that's the COPD acronym on the rightmost, and issues like overweight, obesity, which have to do with how physically active can we be. We see the trend not going in the way we would like. And we see disaggregations of those trends being worse for some populations than others. A key parameter affecting health in our county is poverty, and not just the lowest income, but being lower income is a real challenge to achieving health. And then income is also influenced by race. So while we are the second healthiest county in California by a national measure put out by the Robert Wood Johnson Foundation, and we are among the wealthiest and most prosperous counties in the country, this prosperity is not felt equally by all races. And you see that African American community, Pacific Islander community do not experience the same income that the rest of us do. And we also know that if we look at those issues of race, those have implications for health indicators as well. Our life expectancy in San Mateo County in 2018 is still 6 years lower for an African American. That is not okay. None of us should be able to live with that. We have to keep doing better by everyone in our county. We also see that these disparities are reflective by place. So when we look at the distribution of low-income communities across the peninsula and over the Bayside, we see greater concentrations of poverty in the East Palo Alto community, in the North Fair Oaks community. And we know that that too contributes to health disparities. The prevalence of diabetes for the lowest income population is about 4 times greater than for those at above median income. So we know that these are really important considerations for thinking about who and an equity lens in working towards health and environmental justice. The last stat I'm going to leave you with has to do with how our well-being is influenced by our race in our physical and emotional well-being. So we asked residents in our community, have you experienced either emotional upset or physical symptoms because of your race? And while overall it's not 0, we wish it were 0, it's 10 and 6.8% reflectively, you'll see that those bars are much higher for our African American neighbors. And we know that issues of being excluded or issues of discrimination actually have a physical and health manifestation under our skin in the anxiety and stress we are carrying in day-to-day life. So race, place, income, these all matter for health. These are not distributed justly or equitably right now, and these are important considerations for what we pay attention to going forward. I really appreciate these few minutes with you. What I hope I've left you with these facts is a sense of commonality in wanting to get to the root causes, this tree, of those conditions that are down under the surface that affect the ultimate health people can enjoy. Those conditions that we live, work, and play will affect the greenness of the leaves and the prosperity of that plant. At the end of my son's dance performances, after they've asked for permission, they also offer gratitude and say, thank you, Mother Earth, for letting me share my offering with you. My offering this morning has been data. In public health, we say, in God's we trust, all others bring data. So I hope this is helpful for the rest of the day. Thank you very much.